Okay, Gregory, which groups of people are more determined to suffer from hepatitis C and why?
So hepatitis C is what we call a blood-borne virus, and the major groups that are affected by hepatitis C are people who inject drugs, people who had a blood transfusion before we had screening of blood donors. Screening was started back in the early 1990s, so not many people in that category now. Also, a lot of people who were born in countries of higher sort of prevalence who became infected through contaminated injections in healthcare or dental settings. For example, in Egypt has the highest rate of hepatitis C, but very low rates of injecting drug use, and that's because they had a campaign to eradicate a parasite called bilharzia, and they used injectable therapy back in the 1960s and 1970s, and many people became infected that way. So there's a sort of misconception that hepatitis C is just about drug use, but in a global sense, there are many other ways that people have become infected. But it's a virus that is transmitted from contact with blood, so it's blood-to-blood contact.
Mm-hmm. And what symptomatology does this disease evidences, and is it difficult to diagnose?
Sure. So hepatitis C is an interesting virus in that it infects the liver. So that's where it sort of lives and what we call replicates and turns over. But it can be living in the liver for many years without causing much damage to the liver. So a lot of people are unaware that they have hepatitis C. They might have some non-specific symptoms. They might feel fatigued or tired. But it's not until they develop cirrhosis or liver failure that they feel very unwell and they have a lot of symptoms. So, and that makes it often difficult in terms of testing people for hepatitis C because not many people come forward for testing because of symptoms. You have to understand how the virus is transmitted and then educate doctors and other healthcare workers in terms of screening those people that might have been at risk of hepatitis C.
Mm-hmm. So we're talking about a preventive treatment in order to treat these people.
So the interesting thing about hepatitis C is that at the moment we do not have a vaccine for hepatitis C. For hepatitis B, which is a virus that also is transmitted readily and also blood-to-blood borne virus, we do have a highly effective hepatitis B vaccine. But we're trying to develop hepatitis C vaccine, but that may be many years away. The new treatments for hepatitis C are so amazing in terms of the cure rates. They're curing more than 95% of people that we treat. So one strategy is to use the treatment as a prevention. So if you can reduce the amount of infection in the community, you should be able to reduce the amount of virus that's being transmitted in the community as well. So that's what we call treatment as prevention. And that's one of the strategies that we're looking at.
So from Curtis Institute perspective and regarding all your investigation that you're performing to try to heal this disease, definitely, is there any other ways to eradicate this hepatitis C? Like you were talking about a vacuum. Is it believable that in a close future, hopefully, you'll be able to develop a vacuum against this hepatitis C?
So I think a vaccine against hepatitis C is possible, but it's a little bit like the development of a vaccine against HIV. It's really tough. These viruses are very clever. They evade the immune system. So it's taking a lot of effort and a lot of investment to develop vaccines. But while we're waiting for that vaccine to develop, we do have other strategies that work in terms of preventing transmission of hepatitis C. We know, for example, for drug users, that if you provide clean injecting equipment, that reduces the risk of hepatitis C. We know that for many drug users who are dependent on opiates such as heroin, if you can offer methadone or buprenorphine as a replacement, that helps. But we also know that these treatments, because they're so curative, that they should have an effect in terms of prevention. For example, we have a very large project in the prison system in Australia where we're evaluating if we can treat the majority of prisoners who have hepatitis C, we should be able to stop the level of transmission of hepatitis C within the prison system. And that will help the broader community in terms of, again, reducing the pool of infection in the community And also it will help the individuals, obviously, in terms of their potential risks of developing severe liver disease.
And what advice would you give to the community, to these individuals, to prevent the transmission of hepatitis C?
I think one of the keys to prevention is to have strategies for drug users that are not judgmental, that look at drug use as something that is part of society, to acknowledge that, but to provide evidence-based, important public health measures to reduce the risk for drug users and to offer them treatment that's successful to improve the lives of drug users. And I know here in Spain that you have very good harm reduction strategies to reduce the risk of hepatitis C among drug users, but there are many other countries that don't have that. There are many other countries that stigmatise and alienate drug users. I think this problem has to be seen as a public health problem. And the more that we can visualise the solution through a public health solution, the better we'll be.
Mm-hmm. And Gregory, are there any predictions of any sort of moment or fixed year in which we can put an end to this disease?
A lot of people are interested in when we can eliminate hepatitis C globally. The World Health Organization has set a target of hepatitis C elimination by 2030. That's not eliminating every single infection in the world. That is going to be impossible without a highly effective vaccine. But the WHO has set a goal of treating 80% of people with hepatitis C, reducing the rate of transmission of hepatitis C by 80%, and reducing the death rate from liver disease by about 65%. And I think those goals are achievable. They may not be achievable in every country around the world. I think, based on what I've heard recently, they're very achievable in Spain, and we believe that they're achievable in Australia. But they will only be achieved if we have an approach that reaches drug users with hepatitis C, that offers effective treatment.
Thank you very much for attending our interview.
Thank you very much.